Well, I think the one biggest factor with COVID-19 is that this virus, we've never seen it before. We've had tons of different types of viruses come through, but COVID-19 is what's called a novel virus, and no one has immunity to it. Other viruses in the past, with coronaviruses, Norwalk viruses, influenza viruses, some people have built-in immunity. Some people have acquired immunity through vaccines, through what's called herd immunity. But this virus is novel, which means no one has ever seen it before. That's why you're seeing it rip through towns, states, countries. So that's one of the biggest differentiating factors between this one and ones we've had in the past. I think one of the biggest things that you have to do is you have to what's called risk stratify yourself. Most of us have really good immune systems. If you don't think your immune system is what's considered a good immune system, then you might want to really strictly follow the guidelines that you're hearing about on TV, from your neighbors, from your own doctor, with social distancing. I'm fairly comfortable with my own personal immune system, and most younger, healthy people have pretty good immune systems where even if they do contract the virus, they're gonna fight it off pretty well. You might get a little fever, you might get a little cough, but most people are handling this virus fairly well based on their own immune system. But if you're elderly, if you're on immunosuppressive medication, if you have an immunodeficiency type of a medical condition, then you may want to try to social distance just so you're not as likely to contract this virus by catching it from someone else. Why do some people seem to get sick every month throughout the winter, and some people never get sick? That's just their built-in inherent immune system, which helps them to fight it off. So take it one step further. When someone gets hospitalized with something like this, some people are teetering right on the edge of needing a respirator, and some people, fight it off fairly well with different types of nebulizer treatments, different types of inhalers. So no matter what level, whether it's lower, medium, or upper tier, your own immune system does come into play here. And there's also so many other aggravating factors. Was that person an asthmatic leading into this? Was that person a cigarette smoker leading into this? So many of those other factors, but in a nutshell, it all comes down to how good is your immune system and how much extra aid do you need from the medical community to help to fight this off. Most of the masks you're seeing recommended in this situation are designed to protect people around you. As you see on TV, and if you watch some of the newscasts, they're recommending homemade masks, which they're saying are fine. I mean, if you have access to the better, fancier masks, that's great, but they're really recommending homemade masks. Basically, whereas if you were to cough or to sneeze, you'll be protecting people around you. Even when you talk, some respiratory droplets have the potential to get out. And when you cough or sneeze, that's going to increase the chance of you spreading that type of a virus. So that's why if you watch these news conferences, some of the spokesmen that come on will say, my mask protects you and your mask protects me. That's generally why they're allowing so many different types of masks out there. So we're basing this on some of the experts, and Dr. Fauci being the lead expert for infectious disease out there, kind of taking his recommendations and other viruses that he's seen in the past, and he's making recommendations for this virus based on his experience. I wear a mask when I'm in public tight quarters, only because they're making those recommendations on TV for that. When I go for a walk around the block with the family, I don't wear a mask. I go for a bike ride with my daughter, I don't wear a mask. I'm talking to patients in my office on the phone, I don't wear a mask. Now, we do have several patients a day coming into our office, and I will wear a mask when I'm face-to-face with them, because I'm not sure how good their immune system is, and I'm not sure what their status is with having COVID-19. So when I'm face-to-face with someone, I will wear a mask. But my general recommendation to people is when they're going outside is, number one, we want you to go outside. We want you to walk. We want you to ride bikes. I've had some patients say, I go around the block, and if I see my neighbors, I put my head down, I don't talk to anybody. And I said, that's not necessarily what we want you to do. We want you to stop and talk to people. We want you to have social interaction. Just don't wrestle with your neighbors, just be careful about how much interaction you're having with them. But I do want people to go out. We do want people to interact. You just have to be aware that other people's immune systems may not be as good as yours. So if you're going to be in close contact with someone, then it's recommended to wear the mask. What you're referring to is the antibody test, and right now it's the Wild West for antibody tests. Some of these antibody tests are coming out and they're not FDA approved. So I'm not opposed to these tests. I don't think they're dangerous to have your blood drawn, but we're waiting for guidance from the FDA with what to do about these antibody tests. So for instance, in my office, we are all getting tested this week with the antibody test to see if we have made antibodies to this virus. Because, assuming that I had this a couple of months ago when it first kind of came out, I should make what's called immunoglobulin, and the immunoglobulin fights or helps my immune system to fight what might be coming in the future. For instance, if you checked my and most of our immunoglobulin right now for the chickenpox virus, it'll be positive, which means I had chickenpox when I was a teenager, and to this day I have that what's called IgG to help to fight future exposures to chickenpox. So the blood test that I'm going to get actually tomorrow will tell me in a couple of days if I not only got exposed, but did I make antibodies, which would make me far less likely to get COVID-19 if I'm exposed again. We think there's one predominant strain of COVID-19. People were talking about a potential other strain of COVID-19. So even if you had it the first time, you may be prone to getting it again, but we're not sure about that. So let's assume we're talking about the one main strain of COVID-19 here. So once I get this test done and it tells me I have made these antibodies to it, the next step here, and they haven't quite start doing this for the public, but they're doing it in very small trials and small studies, is they're going to go to someone like me, assuming I already had it, or the people that we know have had it, and they're going to want plasma donations from them. Because if you can get a plasma donation from someone that has antibodies, they're attempting right now to find a way to spin that down, make a vaccine, and give it to people that are at risk, especially the elderly, the immunocompromised people. And they love to be able to do this by this fall or this winter. That's a really tricky thing, though. You hear Dr. Fauci talking about stuff like that, and he's not so sure that we're going to have a vaccine for this coming year, just because of the testing, and there's so much that goes into that to get an FDA approval for a vaccine. We're not sure that in 5 or 6 months from now that's possible, but they need to harvest the antibodies. They need to let the microbiologists do their work, identify the antibody, and see if we can make a vaccine from the antibodies of people that have already tested positive. If I had to predict right now, I think there will be an FDA-approved vaccine. Not in the fall, though. I think, if anything, it'll be out in the winter, January, February, and the people that are going to be first in line to get it are the over 65 or the over 70 crowd. It depends how many doses they have, or the immunocompromised younger folks. They'd be the first in line to get it because they'd be the ones that are most at risk from this virus. Let's say after the vaccine comes out, it's going to take months to get people vaccinated, and then months for them to build antibodies and build protection from the virus. So now we're into kind of next spring already here, and we don't think that the virus replicates very well in the heat. So hopefully as we get into this summer and then next spring and next summer, hopefully that'll slow things down on its own. Right now, for the last 6 or 8 weeks, we've been doing about 90% of our visits by what's called telemedicine, whether it's a video chat like we're having here or a telephone chat. Medicare very quickly relaxed their rules on how to communicate with our patients. Whereas, before we had every single one of our patients coming into the office with a few phone calls here and there. Well, right now, based on the general recommendations, we're doing 90 to 95% of our visits virtually or by phone. And temporarily, you can get away with that. I have people checking their sugars at home. I have people checking their blood pressures at home. And then very slowly, we're going to transition patients back to our office. We've taken the precautions. We're not going to have anyone in the waiting room at the same time. We're putting up the plastic shields, for our staff, for our receptionists in the front. We're going to have masks and, and gowns if necessary, depending on what the patient is there for. We're going to screen them at the front desk for fevers and coughs and stuff like that. So we're going to do as much screening as we can over the phone. And Medicare and the other insurance plans right now are allowing us to do things virtually through the end of June. And then we'll see if they have any recommendations coming out after that. But we're slowly going to transition to getting patients back in our office in June. I'm telling patients that don't be scared. Don't sit there and watch the news for hours and hours and hours, because I'm on the phone. I talk to 30 people a day on the phone, 30 patients a day. They answer the phone and they sound great. And I ask them how they're doing and they sound great. And I ask them, and then they say, oh, yeah, but I watch the news and the breaking news, breaking news, breaking news. And then by the end of 3 hours of news, they don't feel as well as they used to, because they're emotionally getting grind down from this. So I'm telling everyone, get out. Your immune system is good. You have to rely on your immune system, and to get out and do your walking, say hi to your neighbors. You can stop and chat with your neighbors. We want people to respect the virus. We want them to be aware of it. But for most sake, you can't do a whole lot about it. And if your immune system is at risk, then you want to try to avoid it for as long as you can. Notice, for as long as they've been saying, the new phrase seems to be, flattening the curve. At no point did anybody say we're eliminating the virus or we're going to make you not get it. I mean, once a vaccine comes out, that's a different thing. We can possibly defer it then. But right now we're flattening the curve, which means we just don't want everyone getting it at once. We want people to kind of get it here and there and there, so we don't overwhelm the hospital system.